This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Okay, so again, welcome everybody to our presentation on the residency program at JFK Johnson Rehab Institute. My name is Dr. Leslie Begay, and I'm the Assistant Residency Program Director. We are located at JFK Johnson Rehabilitation Institute, which is attached to JFK Medical Center in Edison, New Jersey. We're very excited to be here today, and I know that the chiefs will be able to answer a lot of great questions for you, but I'd like to go through some key points about our curriculum with you today. So myself, I introduced, but Dr. Sarah Cucurullo, who would have loved to be here today but is away, is our residency program director and also chair and professor. We are the Department of PM&R for two medical schools, both Rutgers Robert Wood Johnson Medical School as well as Hackensack Meridian School of Medicine. We are located in Edison, New Jersey, and we are attached to an acute care facility called JFK Medical Center. It is a 475-bed acute care hospital. This is a tremendous benefit to our residents because we are attached to the hospital and have access to consultants and medical support staff that our residents can utilize, especially when they're on the acute care floors. Many of the consultants have privileges at both Rutgers Robert Wood Johnson Medical School and Rutgers Robert Wood Johnson University Hospital, in addition to JFK Medical Center. So our patients that come from these facilities also have a great continuum of care. We also have a 24-hour code team and many other benefits of being attached to an acute care hospital. The next thing I'd like to speak about is our academic curriculum, and then I'll talk about our clinical curriculum. We have a very structured academic curriculum that covers the 12 main topics in the field of PM&R. Each month over the course of the year, we cover a separate topic during our protected block time, and this is usually on Tuesday mornings from 8 a.m. to 1 p.m. During this time, we have lectures from visiting professors, journal club, and grand rounds, and they all focus on that one particular topic area. So for example, stroke is a topic area for 1 month, traumatic brain injury another month, for example. In the curriculum, it goes over the course of 1 year as there's 12 major topics and 12 months in the year. And we have the benefit of having the curriculum repeat 3 times during the duration of the residency program. As I said before, the entire month is committed to each of these 12 major topics, where not only do we have guest speakers and workshops built directly into the academic curriculum and our protected block time, but great part as well is that the curriculum and the lectures are also resident run. So a resident class, either the PGY 2, 3, or 4 class, is responsible for presenting a lot of the major curriculum topics for that month. Part of our academic curriculum also includes a senior board review course. It runs from January through June during the senior year and follows the structured academic curriculum that occurs for 3 years during the training here. We have a published board review book, which if you haven't heard of, you probably will. It is the PM&R board review book, and it contains the notes from the board review course that we offer. It's covered over a 6-month period of time, and by the end of the residents' senior year of their training, they're ready to take a mock exam that we've created, and then the actual board exam that is in August after graduation. We actually provide mock exams for our residents, both for part 1 and also mock orals for part 2 after they graduate. And I think that's a really nice benefit of our program as well. Other aspects of the academic curriculum include a cadaver course. We also support residents to attend many outside courses as well, benefiting from some of the strengths of other programs that are in this particular area of the country. We go on a prosthetics and orthotics and a gait course as well. Within our program, we also have workshops, which we have at JFK Johnson Rehab Institute on spasticity, joint injections, a tracheostomy workshop for the PGY2 incoming class. And we also have, which I think Dr. Heckelman may have mentioned, we have monthly ultrasound workshops where the residents get 2-hour workshops working with our sports medicine trained physiatrist, who's also boarded in sports medicine. And during these sessions, he educates and trains our residents in ultrasound on all the major joints of the upper and lower extremity. This also extends into the clinical realm where we utilize ultrasound on many of our outpatient rotations. We also have research opportunities and a research requirement. So that was about our academic curriculum. Now for our clinical curriculum, I'd like to highlight that one of the most beneficial aspects is that we have a 1-to-1 attending to resident teacher ratio with individual teaching and assessment for each resident. The rotation schedule is formatted to allow the residents to focus on specific areas of PM&R. And each rotation block is about 2.4 months long. So we focus in PGY2 year, as you can see on the slide, on inpatient brain injury, cardiopulmonary, spinal cord injury, Parkinson's disease, and stroke. PGY3, spasticity, EMG, MSK, sports concussion and pain, and orthopedics, pediatrics, and spinal cord, as well as a consult service. And then PGY4 year, more outpatient rotations in prosthetics and orthotics, EMG, pain trauma consults, as well as a new rotation on subacute aftercare and stroke recovery and elective time. Part of the assessment of residents is in the clinical competency program, and this assesses the competency of each resident at the end of each rotation. This assessment ensures residents know how to do all the appropriate procedures and clinical exams for each one of the individual areas that we cover in the clinical realm. There's ample hands-on experience for all the procedures that you see listed here for EMGs, ultrasound, botulinum toxin injections, and baclofen pump refills, joint injections as well. For a lot of these procedures, we not only meet the ACGME requirements, but the residents exceed those numbers. Another unique aspect of our program is the ample elective time, which is about 2.4 months in duration. 1 month is allowed out of house, which allows the residents interested in fellowships, for example, to showcase at other programs. The rest of the time is required in-house, and there's also the opportunity to do research and specialize during this time period. We also have an optional sports program for anyone interested in sports medicine. They can be involved in high school football games, physical exams, as well as wrestling weight certifications. We also offer 2 one-year ACGME accredited fellowships here at JFK Johnson Rehab. One is in pain management and one is in brain injury medicine. For our graduates, about 50% go into private practice and 50% go into fellowships. Recent fellowships include, and you can see from the slide listed here, traumatic brain injury at Mayo Clinic and TIER in Texas, cancer rehab in Pennsylvania, pediatric rehab at Columbia, as well as the University of Pittsburgh, interventional pain medicine at our own host institution, as well as at Montefiore and Penn Spine and Sports, and then sports medicine at Montefiore and Geisinger. After our residents graduate, they also go into private practice, as I mentioned, but also into academic medicine. And these are some of the universities that our alumni now work at. So I just wanted to give you a little background on me. I was actually a resident at JFK Johnson Rehab Institute. I was a chief resident, and then I was first hired as an attending faculty here in the Department of PM&R. When I started, I was an assistant residency program director and also worked with the medical students and the residents as a clinical assistant professor. I also, while I was here, became medical director of our cancer rehabilitation program. So I think Dr. Heckelman started to say how we've had a lot of great changes in our program over the past couple of years. And I can say, or a couple more years than that, the number of faculty in our department has more than doubled in size. And that's created many more clinical opportunities and specialty clinics. So for example, we have the Aftercare and Stroke Recovery Program, which is also now part of a huge stroke recovery study, which has already led to many publications and now will be a prospective study going on. We also have a very robust concussion clinic led by one of our traumatic brain injury specialists, Dr. Grease. And we have our Center for Sports and Fine Medicine. So since a recent change in our resident class where we went up from 4 to 5 residents per year, and that's now a permanent change, we've also had the opportunity to add new rotations. And one is a sports medicine and concussion and interventional pain experience for the PGY3 residents. So I know a lot of them are very excited about this. One of the newer changes during the PGY2 year is an inpatient Parkinson's rotation, as well as expansion of our cardiopulmonary experience. And then during PGY4 year is a subacute consult service experience, along with a transition of care experience in our aftercare and stroke recovery outpatient clinics. I think one of the great things is that getting to know a lot of our residents who are amazing individuals. They've been some of our most recent new hires and have added great expertise and experiences to our faculty.
About 4 minutes, Doctor.
Oh, yeah. Okay. So I'm going to finish up because that will then let the chiefs talk a little bit more. But if you have any other questions, please reach out to our coordinator, Beverly Bolger. That's her email or her extension at JFK Johnson Rehab. And I will stop screen sharing.
Okay, guys. So at this time, we can kind of field your questions. Feel free to put them in the chat. I think if you'd like to turn on your mic or video, feel free to ask that way as well. Go ahead, get started.
So while we're waiting for questions, I'll just talk a bit about why I chose JFK. I always knew I was interested in brain injury rehab. So as was discussed, JFK has a strong ACGME TBI fellowship. So I knew I could get training there. Since I've been there, I've had great mentorship. That been able to do a lot of research. So all of that is really supportive of my goals in TBI specifically. We also have an inpatient BTU with 20 plus patients generally. So you get really good exposure to all the different spectrums of TBI, such as like disorders of consciousness. But we also have like concussion clinic, so you can see the mild TBIs. So all that is a good education. So in general, when you're looking for a program, think about what fellowships they have to offer. It also influences the level or quality of education.
Dan, maybe if you want to take that first question, where do residents live? So the question is, where do residents live? Apartments, buy or rent homes?
So majority of people rent apartments. There's a lot of apartments that are being constructed nearby. So I live about 10 minutes away from the hospital, which for PGY2 year is really great because you have more calls so that you can come in easily. And we do home calls, so it really matters where you're living too. So I'd say generally people rent. There's a lot of families living in apartments too. So they're generally very nice, a lot of luxury apartments.
About 2 minutes left.
Dan, I'll just field this next question to you as well, since you are the king of research. What are the research opportunities like, and is there a dedicated track for it?
There's not a specific dedicated track, but I will say every attending is willing to be involved in research. So I've worked with many of the different attendings to write like literature reviews, case reports. We also have involvement in model systems for TBI. So this is for me more specific, my experience, but be able to work with Dr. Greenwald, who is the fellowship director, and also the medical director of the brain trauma unit. He is very much involved in research. He's always publishing every year, so it's great to tag along with that too. And then we always submit a lot of posters, and we have really good support in going to conferences. So generally, a lot of the residents get to go to the conferences too to get posters on their CV.
Okay, so I'll just field this next question on Mike. So Dr. Begay already answered that we get EMG experience in both third and fourth year, but Mike, if you could just quickly talk about the amount of procedure experience that we get, because I think we more than meet our numbers.
Yes, once you start your PGY3 year, and even in your PGY2 year while you're doing inpatient acute rehab, you will have a lot of opportunities to do procedures. But once you're a PGY3 and a PGY4, you're really that's kind of your daily grind. For example, our spasticity numbers are way in the 200s plus. I remember my first day of starting spasticity rotation, the first patient, Dr. Scaldi, our attending, will do that injection, and then the second patient that we see that day, he's like, Mike, you're up. And so from then on, it's all you. I think procedures are something that is kind of bread and butter at this point. It's something that we get a lot of exposure to, so nothing that you have to be worried about. We get way more than the ACGME required numbers.
Thank you all so much. I really appreciate it. We are at time.